Anyone who's concerned that the cancer in their family could be hereditary should speak with an expert known as a genetic counselor or a healthcare provider who's had advanced training in genetics. In some families, we see a lot of cancers, and sometimes they're caused by a change in a gene known as a gene mutation, and that can cause cancer to run in these families. It's important for anybody who's concerned about the cancers in their family to gather their family medical history as completely as possible and also make sure that they share their own medical history with their family members. The most common gene changes that we see that are associated with inherited breast and ovarian cancer are called BRCA1 and BRCA2. And there are tests that can be done to tell if this mutation runs in a family. Some of the signs that we see that can indicate that there's an inherited mutation in the family include ovarian cancer, fallopian tube cancer, or a type of cancer known as primary peritoneal cancer in a family member at any age. Breast cancer that's been diagnosed before age 50. Anybody in the family who's had breast cancer in both breasts. A type of breast cancer known as triple negative breast cancer, or breast cancer that occurs in males in the family. Those can be signs of a hereditary cancer syndrome in that family. The other things that can indicate a cancer syndrome are if there's two or more family members with breast cancer or prostate cancer, ovarian cancer, pancreatic cancer. When we see multiple cancers in members on the same side of the family, that makes us concerned that there could be an inherited mutation in that family. There are other hereditary syndromes that are different than BRCA1 and 2 that can cause different types of cancer. There's a syndrome known as Lynch syndrome, and that's associated with ovarian, uterine, or colon cancer running in a family. And there's a type of mutation known as syndrome called Cowden syndrome, and that can be associated with breast cancer, thyroid cancer, or uterine cancer running in a family. So again, it's very important for any family that is concerned that the cancer that's in their family may be hereditary to see an expert known as a genetic counselor. You can visit the website facingourrisk.org to learn how to find a genetics expert in your area.
Did you know that not every breast cancer patient needs chemotherapy? In fact, today, there's a way to identify whether or not you'd benefit from that chemotherapy based on the biology of your tumor. To learn more about the Oncotype DX assay and how to discuss the results with your physician, just press this button.